Hi, I am Narika Moss and I am an epidemiologist. I am here to provide knowledge on how you can protect yourself from the human immunodeficiency virus, more commonly known as HIV. HIV is a retrovirus. This means it is acellular and only harmful or active when it is inside of a cell because it does not reproduce on its own. Infection begins when a virus attaches to an immune CD4 cell and fuses with it. While the host cell replicates its own DNA for protein synthesis, it also replicates the virus's DNA, which has integrated into the host cell DNA. The viral proteins then use the membrane of the host cell to form new viruses that can infect other immune cells while killing the host cell by bursting its membrane. It also kills immune cells by exhausting their resources and causing gross distortions that trigger cell death. The number of viruses present in a fluid like semen, breast milk, blood, vaginal, and anal fluids is called viral load. For HIV transmission to occur, these fluids with a viral load must get into the bloodstream of an HIV-negative person through a mucous membrane found in the mouth, rectum, vagina, or penis tip. Therefore, HIV is transmitted through sex, pregnancy, childbirth, injections, and breastfeeding. Injection transmission occurs through the use of used or unsterile syringes or needles, or in the uncommon case of healthcare workers, by accidental needle sticks. Contrary to popular belief, HIV is not transmitted through air, water, saliva, or touching that does not involve the exchange of bodily fluids. Persons with HIV experience flu-like symptoms like fever, sore throat, chills, and fatigue. They also experience rashes, muscle aches, swollen lymph nodes, mouth ulcers, and night sweats. But of course, an official diagnosis through various tests is best to detect the viral load in a person's blood and ascertain that a person has in fact contracted HIV. On average, HIV tests will determine an HIV infection about 2.5 weeks after exposure. HIV tests can be done at local hospitals, clinics, community health centers, or at home using a self-test kit. HIV rashes can be itchy, painful, blotchy, raised patches, or blistery bumps anywhere on the skin, including the face, back, arms, and hands. The color of the rash varies with patient skin color. These other photos illustrate oral candidiasis, mouth sores, and swollen lymph nodes in HIV-infected persons. There are 3 stages to HIV infection. In the first stage, infected persons experience flu-like symptoms about 2 to 4 weeks after infection, and symptoms may last a few days or several weeks. Due to the rapidly increasing viral load, there is a large amount of HIV in the infected person's bloodstream, so they are highly contagious. The second stage of HIV is called chronic HIV infection or clinical latency. Persons in this stage are often asymptomatic, but may experience the previously mentioned symptoms like fever, fatigue, swollen lymph nodes, as well as diarrhea and weight loss. Other symptoms are because of increased susceptibility to diseases that usually don't cause illnesses in healthy persons. These are known as opportunistic infections. Examples of these include pneumonia, herpes zoster, and oral candidiasis. This stage can last over a decade without treatment, and with treatment it can last even longer. HIV treatment is critical during this stage to prevent an increasing viral load which leads to stage 3 HIV infection or acquired immunodeficiency syndrome. It takes about 8 to 10 years for an HIV-infected person to develop AIDS. Persons with AIDS have a high viral load, so they can easily transmit the virus, and they are highly susceptible to opportunistic infections. Persons with AIDS have about a 3-year life expectancy without treatment. In 2021, worldwide, there was about 38.4 million people living with HIV, while 1.5 million contracted the virus and 650,000 died from HIV-related illnesses. About 75% of HIV-infected individuals were receiving antiretroviral treatment. HIV has a reproductive number or R0 value of 4. This number indicates how contagious an infectious disease is, or the average number of people to be infected by one person. This number specifically applies to populations that are especially vulnerable to the disease due to never having it before or having no means to control the spread. But of course, with preventative measures and treatments, HIV's transmission rate will diminish. Antiretroviral therapy is a treatment for persons with HIV. However, it does not cure HIV. It involves the infected person consuming a combination of HIV medicines every day. ART prevents the replication of HIV, which reduces an infected person's viral load and allows their CD4 cells to survive so that their immune system functions well and HIV is not detected by tests. ART can be classified as a treatment and preventative measure because infected persons receiving this treatment do not transmit the virus to their sexual partners. You can prevent HIV infections by refraining from sharing used needles, syringes, and other injection equipment. A major preventative measure is abstinence from unprotected sex, especially with multiple partners. This can not only protect people from contracting HIV, but also other STDs. For persons with a high risk of HIV exposure, whether by having an HIV-positive partner or by engaging in high-risk behavior, pre-exposure prophylaxis or PrEP medication may be prescribed to significantly reduce the chances of HIV contraction. If you believe you have been exposed to HIV, post-exposure prophylaxis or PEP may be prescribed and must be taken within 72 hours of suspected exposure. Another preventative measure is getting your partner tested before engaging in sexual activity, or if you have a pre-existing STD that increases your risk of contracting HIV, receive frequent HIV testing. If you or a loved one believe you may have contracted HIV, please seek medical attention. Also seek medical attention if you are at risk of HIV contraction due to recent unprotected sex, an accidental needle stick, receiving an unsterile piercing or injection, or if you have another STD. If you have been diagnosed with HIV, it is recommended that you visit your healthcare provider every 6 months. Remember, there is currently no cure for HIV, and once you have contracted it, you have it for life. Stay safe and protect yourself. We can stop the HIV pandemic.